let's say you disagreed with me, you'd say why. And if it made sense, we'd like air our differences publicly on the substance of it. Like what happens when Tony Fauci does this is you're absolutely right, it sends a signal to all the other scientists in biomedicine that if you step out of line, if Tony Fauci says, I am the science, if you disagree with me, you're disagreeing with science itself. If you step out of line, your career is at stake. You don't want every crank idea, but this was not a crank idea. These were prominent people in respected institutions saying, look, this policy is wrong.
Yeah.
Any sufficiently advanced technology is indistinguishable from magic.
Welcome, everybody, to a special conversation with someone I've admired for a very long time, both for his intellect and his perspicacity and all the things that he does, but ever more so since he's taken such a courageous stand in our public discourse around the COVID-19 pandemic, co-authoring the 2020 Great Barrington Declaration, doing many, many other prescient things that are only now being recognized by the wider audience. We'll get into that and some of the controversy that is still swirling around. But this is Dr. J. Bhattacharya, who is a professor of medicine, economics, and health research policy at Stanford University, and the director of Stanford's Center for Demography and Economics of Health and Aging. You really couldn't design better, Jay, if they had like a lab where they could design things, for gain of function purposes. I mean, I really feel like you're one of the, kind of, for lack of a better word, of redundancy, most unique. I hate that phrase, but it really applies here. You've got this incredible blend of raw intellectual horsepower, just ability to ignite, but do so with grace, with humility, and with many great qualities. So it was an honor to meet you finally. We were together about a month ago in Italy, and we'll talk a little bit about some of the side trips we got to take. But Dr. J. Bhattacharya, thank you for joining me on the Into the Impossible podcast.
Ryan, thank you for that very kind introduction. I have to say, like with most of my career, I wondered what the heck I was doing because I didn't know what the particular combination of things I was interested in would really apply to until the pandemic. Then it sort of became a little more clear to me, it caused some uproar in my life, but thank you for that.
Yeah, and I always think the rarest of all the human qualities is to be courageous, and especially so when so much is at risk, and to do so with no expectation going in and no remuneration thereof, and in fact probably quite potentially ruinous for people. So to take on the courage that you did, and I want to get into because I am a practicing Jew, as you know, and you're a practicing Christian. I wonder if our worldviews, which are different theologically, but not in terms of our practice, I think. Do you think your faith played a role, from the outset in the mission that you undertook? And we're not, my audience is not, so keen to be. We're not going to proselytize. Don't worry out there into the empire. I won't do that. But the point being, do you think it guided you? Do you think that it sustained you during the controversy that we're going to speak about?
I mean, I take my faith seriously, as you know, Brian. I know you do too. And I found common cause with people, basically, of no matter what religion, who take their faith seriously. And I can't say, like, in terms of the scientific work, it didn't say, find some result or this or that result. Science is science, and you apply the standards of science to it. I think, and I try to do that. But in terms of, I felt like I've had to speak out, and my faith, one of the main core components for me is this desire to speak for the poor, to work if I can to make the lives of the poor better, and especially in health policy, it's a place where people's fundamental values about what happens in their life, their health, their well-being, how that's distributed in society. Those are like absolutely fundamental topics in health policy. And for me, it's my faith is part of that. It's part of like why I care about this topic so much, because I think that what's happened during the pandemic policy we followed, have been absolutely devastating to the lives of the poor, to children, to vulnerable people. And that is definitely has driven me.
Yeah. And looking at the mentality of our fellow citizens and how they react to not just the pandemic, but the lockdown, I think was the significant contribution. Of course, you're a medical doctor. You have unique insight into the most vulnerable population. But it was really, people call it, well, because of COVID, we had X, Y, or Z. But really, it was the effects of the pandemic lockdown, not the pandemic itself, that really drew most of your attention, and actually where I think you made tremendous contributions, which may only be recognized, decades from now, and in the prevention of similar mistakes. But I, you don't have to react to that. But I did want to, kind of, when I met you and we spent some time together, I was reminded of another prophet with the name, starting with the name J, the letter J, and that's Jeremiah. And I wonder, how do you reconcile, some of his famous quotes? I mean, of course, there's a famous one that people like to bring out from abortion debates, which we're not going to get into here. Jay, we can get into abortion, gun control, COVID, however many controversial topics you want to hit. I don't really want to hit controversy,
Brian.
Yeah, let's play it a little safe. But of course, famous quote: "Before I formed you in the womb, I knew you. Before you were born, I set you apart." Does any of the biblical verses, not again, I don't want to talk about abortion per se, but does it give to you, as it does to me, perhaps, a notion that every life is sacred, even our enemies, even those that hate us and do vile things to us, that every life is sacred? And again, we're not talking about abortion right now. I mean, we should talk about that some other time. But does that guide you as a doctor, as a theologically inclined person, or can you divorce being your scientific attributes from your religious attributes?
Well, I think, I love that quote, not particularly because it has a controversial link to abortion, but because it gives this sense that we are each of us created with a purpose, that we are given our gifts for a reason. They're not just for ourselves. And I think that I love that, because that idea that we're all made in God's image, that means I have to treat you like you're made in God's image, with respect and with dignity, and help you with your purpose. I mean, I love that. I love that idea, and it has animated my work, and animated how I try to treat each other. It's been really difficult during the pandemic. I've made a lot of enemies, unfortunately, not intentionally, but just by my ideas. And I've had to work very hard to remember that even they are made in God's image, are people that are worthy of respect, worthy of dignity, and to work to forgive them even if they've harmed me. Those are like personal attributes. I think in science, we have an obligation to speak what we see as the truth, based on our work, to the best of our abilities, to correct ourselves when we get it wrong, and to treat each other with dignity and respect, even if we disagree. That quote from Jeremiah, I think, I love that, because I think it underlies a lot of that kind of ethic, and I've tried to live that as best I can.
And his other quote, of course, that I love to trot out at faculty meetings is, "The heart is deceitful above all things and desperately wicked. Who can know it?" So he's famous for these Jeremiads, where we get the name Jeremiah, which is kind of a clarion call, a warning. I've written a little bit about that, and completely uncourageous stance compared to you, just with regard to.
There's this Alexander Solzhenitsyn quote, which is probably my very favorite thing. Yeah. Favorite quote is this. I think he gave it as a speech at Harvard. Solzhenitsyn, of course, the Soviet dissident who wrote the Gulag Archipelago. He said, "Look, the line between good and evil cuts through every human heart. Yeah. There is no purely good and purely evil people. We're all in some sense a mix, and we're trying to get along with each other in that sense of with that. And if we understand that, then it's much easier to treat other people with respect if we can. It's hard sometimes when people are attacking you, but I've tried to remember that."
Yeah.
Hey friends, just a quick request while you're enjoying this video to leave a thumbs up. My thumb's a little bit preoccupied with all Carl Sagan over here, but I hope yours is free enough to leave a like. It really helps me with the algorithm. And for extra credit homework assignment, leave a comment down below what you're enjoying about this video. Now back to the show.
Especially as we'll get to, people that portray themselves as devout Christians, and then come down with profoundly not only unchristian, but perhaps undignified ways of behaving. I want to pivot from our theological discussion at the outset here to a notion of that which came to sort of replace it. We were, of course, replete with this in Renaissance Italy. And that's science. And of course, science, the people that write history, the victors, right? So they got to call themselves the Enlightenment. They got to call themselves the Renaissance. They got to call the previous ages the Dark Ages. So, it's kind of, I've heard that the English, as in UK textbooks, don't mention the Revolutionary War in great detail, but that's besides the point. is there such a thing as, science? Is there such a thing as the scientific method? Are these just sort of like, hyperlinks that we keep in our mind, but we don't really know what they mean? Do you think there is something that can reasonably be called the science or even the scientific method, quote unquote?
Well, I do think there's a scientific method, but I think that the term that we normally think of as the science it's just like if you take it very broadly, it's an attempt for humans to try to understand how the material world works, how the physical world works, to try to think of explanations for it. The difference between, I think, pre-Enlightenment science, which was science, and it's in reality still science, and post-Enlightenment science is an emphasis on material causes for material outcomes. You don't make reference to God when you say, why did this happen in scientific discussion post-Enlightenment. And I think that's been quite productive, actually. I think it's disciplined people to try to look to see what can be learned just by looking at material inputs. Material meaning just a very broadly material, like, you know much more about the way the universe works than I do, Brian, so I'm not going to try to get into that. But I think the idea that we can learn about the way the world works from experimenting with it with our intellects, that's broadly been true forever, even before the Enlightenment. But the set of explanations that we allow ourselves is limited to the material explanations. That's been quite productive, I think, in our advance in knowledge about the way the material universe works. Yeah. That doesn't mean there isn't a telos. There doesn't mean that there isn't some purpose beyond it. And I think in our everyday lives, it's a mix of our material knowledge. The fact that I know that if I hit a hammer to a window, it'll break. That doesn't mean I should hit a hammer to the window. I mean, those are two different questions. There's a scientific fact that hitting hammers to windows breaks the window, and then there's the question of whether it's the right thing to do to break this window. Might be right if I'm trapped in a car and it's burning. I need to get out. It might be very wrong if I'm trying to break into somebody's house to steal from them. Right. So I think the telos is really quite important for how we live. But for science, especially Enlightenment science, focus on the material cause has been really, really a good thing, I think.
Yeah. When we look back, before we turn to slides that you're going to show from a presentation that you have, when we look back in the pandemic, I first became aware of COVID-19 in early January 2020. And I was at a Shabbat dinner on a Friday night with a friend who listens to the podcast. And he's not, he's like a social psychologist you can think of as a sports psychologist. He helps me get into, fighting shape for my MMA battle. No, he doesn't do that. But he's a brilliant, kind of social scientist. And, he was just saying, what are you up to this year? What are you looking forward to? I said, I'm supposed to go to China, to Tibet, to look at this cosmology project that they've asked me to kind of consult on. And it's kind of maybe a rival to my project, but it'll be kind of interesting to get complementary data from another group that has different expertise. And I'm excited about it. I've never been to China, certainly not to Tibet. And he's you might want to hold off. When are you thinking of going? I said, March, April. And he said, you might want to reconsider that. Did you hear about, they've got this disease? Yeah, I'd heard about it. But he's like, they just built this hospital in 8 days that doubles as a prison. They can weld people into it, keep people out. That's kind of interesting. But, maybe push it off to April, July. Needless to say, I never went, right? I'm still, China still does not appear in my passport. Russia does, but China doesn't. Anyway, the point being that my friend, who's not a member of the NSA, CIA, FBI, DARPA, any of the multi-letter agencies, he knew about this, so like a couple of Jewish yentas, at a dinner, right? We knew about it in January. By that time, there could have been, many, many more precautions, preventative measures put in place, maybe even a month earlier. And as an epidemiologically trained individual, better than I how these things can spread. Is there anything in retrospect, in hindsight, before we get to the actual incredible story of what you have related and experienced, which I begged you to share it with my audience, and so we will. Before we get there, could it have been avoided? Is there any point, in the multiple branching forks of the Garden of Forking Paths history, could we have made it de minimis, like just a sniffle, or was it inevitable from the time it was either created or released or naturally, spread from zoonotic origins? Could it have been prevented by any technology, any scientific or technological insight that humanity as a whole, or the US in particular, could have applied?
I don't think so. I think unfortunately it was baked in the cake. I don't know if it was natural origin or zoonotic, or if it was a lab leak. In either case, the dates of it probably are in the fall of 2019. And the evidence of that is that there are antibody studies from stored blood in blood banks in places like Italy, Angola, from September 2019, where it shows up positive. Now, there's some dispute over whether those are false positives, but I think it's really hard to just to like look at the body of evidence and say it's all false positive. I think sometime in fall 2019, this disease was already spreading throughout the world. It was already outside of China. It's a highly infectious disease. It was too late even by then, had we known about it, to stop it. I do think that the actions of the Chinese government worked to suppress knowledge of it. Especially in December, that became clear. You had some heroic doctors in China speaking up, and they paid the price for it. But certainly by January 2020, when China had really started their draconian lockdown, just as you said, it was far too late, because it wasn't just in China. It had already spread outside the world. You saw in late January 2019, the first cases in the US. Even before that, there were cases in Italy, in Iran. The disease was seeded very widely, especially in the Northern Hemisphere early on. By early on, I mean January 2020. Shutting down travel was too late. It was, I think people thought of this as like the 2003 SARS-1 epidemic, where it really did sort of peter itself out. But that doesn't spread as easily. That virus didn't spread as easily as this virus does. This one seems to spread by aerosols. You breathe in the same, if I breathe in one room and then you come back into that room an hour later, you might still get my COVID. That wasn't true. I don't think it was much harder to spread SARS-1. I don't think there was any mechanism by which we could have avoided the pandemic, short of, if it was a lab leak, not doing those kinds of exercises that led to the lab leak.
Yeah. And of course, that has to be, at least the consideration in any future research or, kind of precautions put into place in the future to prevent this from ever happening again. Do you think that the American public would tolerate another round of lockdown? Let's say COVID-23, God forbid, comes around. COVID-27, I don't care in the future, have we been so scarred, or have we been chastened, or do you think it would just immediately happen again, just as it did in 2020 and beyond?
I mean, I was stunned that the lockdowns were accepted in 2020. I thought there would be much broader pushback against it. What I didn't anticipate was how important fear was in the minds of people and driving the behavior and minds of people in 2020. I mean, you look back to March of 2020, it was a time of great panic and fear in the scientific community, not just in the public. And in fact, governments used propaganda to actually induce fear. It made it very difficult to do any kind of reasonable scientific-minded thinking about what the right policy ought to be. So the answer to your question, I think, is if there is another virus that spreads around and officialdom panics around it, like they did during COVID, I'm afraid that a lockdown would come back, even if it wasn't particularly useful for stopping the spread of that virus, that hypothetical new virus. One of my goals in the post-pandemic time is to try to reform public health systems so that they don't knee-jerk react with fear to to a threat, but instead try to develop evidence very quickly and assess what the right response ought to be in a cool mind, as opposed to panicking themselves and then spreading that panic to the population at large. Right.
We like to think of ourselves as scientists, as dispassionate, as following the evidence. And of course, I have given talks where I speak about political, scientist. But to push back with respect, it's often said that, well, America has one of the lowest numbers of scientists in public policy. And you look at the kind of, crazed reaction and illegitimate, kind of hyperbole surrounding everything, not just around COVID reaction. So wouldn't it be better if our government were, a scientocracy or something like that, where you had the most brilliant, and you and I would be the leaders of it. I mean, this could be great, Jay.
Oh, God forbid, Brian.
Brian and Jay rule the universe. But no, we have brilliant colleagues. These are I know 14 Nobel Prize winners. Some on your campus up there, and why not just have these brilliant geniuses, men and women of science, not only advising, President Biden. I mean, what is he? He doesn't know much about science, I don't think. So why not have an elevated role for scientists in the government to enact policies that are fact-tested, replicable, They are peer reviewed. All these things. Why not? What's wrong with that, Jay?
Well, I'm not against having more scientists advise governments. What I found, and I've had a lot of opportunities during the pandemic to interact with politicians of some who actually are quite adept at following scientific arguments, and others who just it's hopeless. I don't think there's anything wrong with that. The question is, what's their proper role? Right. So scientists can tell you how to break a window, but the scientists can't tell you whether you should break a window. That involves trade-offs, values that people fundamentally have. So you ask about like how scientists performed, official scientists performed during the pandemic. I have to say rather poorly. Yeah. I think there's two things that happened. One is that they, in the midst of panic that scientists themselves, that public health people themselves induced, they were very bad at reading evidence. And then second, they took on themselves this role that we are really unsuited for. We're not philosopher kings, Brian. We have our blind sights, and we have our values, which may differ with other people's values. It's absolutely possible. The way that's mediated in society, in a democratic society, is through politics. Unfortunately, there's no other way, really. There's no benevolent philosopher king that can decide this is the right thing to do. You have to have the possibility of people of different values discussing with each other, sometimes in unpleasant ways. But that process results in at least some kind of compromise. Scientists, what we can do is we can say, well, if you do A, B is likely to happen. And then everyone can argue with each other whether B is a good thing or a bad thing. We are not very good at that.
So to go back to our kind of origin of our relationship in person, we were treated to a presentation of basically a hellscape, a life basically of nightmarish proportions that I really I was almost brought to tears. I told my wife about this. And the shameful treatment that you suffered, both at the hands of local officials, the media, the press, and then your institution at Stanford, which I called home for a very brief period of time, and then the national government. And I wonder if we could, share some of your recollections. I know it's painful, but I think the world needs to know the story, and I want to play as even though it'll be a tiny role, some component and some role in sharing what you've experienced with the world as both a fascinating, in the same way a horror movie is to me. You're gratified to not be in the movie if you're watching this. What Jay went through, I wouldn't wish on my worst enemies. And I can't really sympathize or empathize with it, but I can just say, how much it moved me. So I wonder if you could share that presentation now, Jay.
I'd be delighted. Although it is having lived through it wasn't the most fun thing, but I think it's cathartic to just talk about it. Okay. So I'm going to tell there's two parts to my story. And it starts basically in March 2020. I had been following COVID, of course, before the pandemic, before March 2020, because just like you, I'd seen those reports out of China and so on. I'd done work on infectious disease epidemiology and infectious disease policy for 2 decades before this. My very first papers were on HIV policy, for instance. And published peer-reviewed literature on this, and I've been paying attention during the H1N1 pandemic. When what happened was that very early on in 2009, during that pandemic, the World Health Organization put out a report saying that there was going to be a 3, 4, 5% mortality from swine flu, or H1N1. Mm-hmm. And what hanted after that was really amazing to me. Like there were a whole bunch of studies in the population at large of antibodies to H1N1, specific antibodies, so that you could measure how many people actually had H1N1, and then what was the actual rate, the prevalence of the disease, as opposed to if you just rely on people showing up at the hospital, you're only seeing the tip of the iceberg, it turns out. Right. Those seroprevalence studies showed a very large number of people in the population during H1N1 having antibodies, meaning that a lot of people had gotten H1N1 and then recovered from it, never went to the hospital. And so those early death rate estimates, 3, 4, 5%, turned out to be 100 times higher than was actually turned out to be true eventually. Took a year or more, but that's partly why the H1N1 pandemic sort of fizzled out. People learned that it was much less deadly than they thought, that it had spread much more widely than they'd realized, based on these seroprevalence studies.
Mhm.
So in March
And just
of
for those that
2020,
don't know, the sera is a blood sample test, right?
yeah, a blood test. So
You're speaking to a lot of cosmologists, Jay. So you know.
yeah, so seroprevalence, sero means blood, and prevalence means how frequent is it.
Yeah.
So you do a population sample of blood. Usually it's just a little finger prick, or sometimes a bigger blood draw. And then there are standard tests to see if you have an antibody that specifically reacts to H1N1 and not to other viruses or other pathogens. So if you have this antibody, that means you've been exposed and recovered. There's sometimes disputes over whether those antibodies actually protect you against getting disease again, but there's no dispute that having the antibody means you were exposed. And you must have recovered because you're not dead. Anyway, so that was the debate during H1N1. And when COVID hit, I had the thought that, look, this is a very highly infectious respiratory virus. Maybe this is happening again. The World Health Organization, this is on the screen, you can see, the World Health Organization put out a report in March of 2020 saying the death rate's 3.4%. Mm-hmm. Well, I mean, my first reaction to that was, this can't be right. They don't know this number. They don't know this number because they don't know how many people actually have been exposed. They haven't run the seroprevalence studies that would have allowed them to actually say what the death rate actually was. And so I spent my entire career, Brian, writing peer-reviewed papers. I have never been on TV. I think I was maybe TV one time in the past. I can't remember. It was like a nothing thing in 2000s, like in the 2000s. And I'd never written an op-ed. All of my work and all my focus has been on writing papers.
Right.
I saw this and I thought to myself, I have to say something. And so I wrote an op-ed, you can see that on the screen, in March 24th, 2020, that changed my life. I mean, it utterly was shocking to me how much it changed my life, but it did. The op-ed, if you read it, basically said, tried to like figure out what the death rate might be based on the very limited evidence we have. And I came to the conclusion that a very wide range of numbers were possible, too wide a range. It could have been very, very low death rate like H1N1 was, or it could have been as high as the World Health Organization was saying. It was impossible to know until you actually ran a study, a seroprevalence study, to measure what fraction of the population had the virus. So that was the conclusion of this op-ed that we wrote was published in the Wall Street Journal in March 2020.
How could you know, just a naive question, I mean, how could you know that it was, I mean, it could also be too low by orders of magnitude if we have no other things to base it on, if it's truly novel, genotype in the history of planet Earth. I mean, couldn't have also been too low? I mean, how did you know to be confident before there were these studies? In other words, I mean, that it couldn't be equally underestimating it. It could be much worse.
Yeah. I mean, so there's two parts to this. It just is way easier than cosmology. So this is very simple. So there's a numerator, the number of deaths, and denominator, number of infected people, right? Yeah. And the number of deaths, you have to wait a couple of weeks because it takes you a couple of weeks between infection and deaths at the time. Mm-hmm. The question was that my focus was on the denominator. How many people were infected? Yeah. And that had to have been an underestimate. That could only really be an underestimate. Mm-hmm. Because we were estimating that based on how many people showed up at the hospital, right, or showed up with positive tests. There weren't enough tests back then. Yeah. The PCR test had just been developed, and there weren't. And remember there was a shortage of that. Oh yeah. And so we were. I think we were very clearly underestimating the denominator. It's true, Brian. We could also have been underestimating the numerator. There might have been people that died from COVID that we didn't catch. I think that's a big problem, for instance, in poor countries where the healthcare systems were poor. But in the United States, basically everyone with a respiratory infection severe enough to get into the hospital was being tested for COVID at the time. Yeah, it seemed unlikely to me that the numerator was vastly underestimated. Mm-hmm. Now there's some people who thought that, but I think it was unlikely. But my focus wasn't on the numerator. Even if the numerator were doubled, it doesn't really change the fact about the denominator that you can measure independently using these seroprevalence studies.
That makes sense. Yeah.
Anyways, I wrote this piece thinking, okay, now that I've put this out, someone's going to want to do a seroprevalence study, never really thinking it was going to be me. And a few things happened. I started getting like some very positive things. Like I got people from around the world offering me help to run a seroprevalence study. Former students of mine who were in other universities offered to help. Ron Ben David, who wrote this piece with me, he's a former student of mine who's now a professor here at Stanford, very prominent, well-known infectious disease epidemiologist and doctor. He offered to help run the study. I got an email from someone in Major League Baseball, Dan Eichner, who runs essentially like cheating, testing for steroids and stuff for Major League Baseball players. He runs this major independent lab, and he had ordered a whole bunch of of antibody tests from China. These were in short supply; it was really hard to get them. But he'd had he basically had the foresight to say, look, baseball is going to need them. I'm going to order them for baseball.
Wow.
And he had a huge stash of them. Huge. I mean, it was like 10,000 tests he had available. And he called me up and he said, look, I don't want to use this for baseball. I want to use this for science. I want to use this for public health. And I want you to use them for running a study. And just offered them up for free. Wow. It's just, it was a really good feeling. A lot of people were coming together to try to answer this really important question. How big is the denominator? We really needed to know this number in order to understand what the right policy ought to be. At the same time, I wrote this piece and I started getting death threats. I got friends of mine who from Stanford who defriended me on Facebook. I got like this is some of the vilest emails questioning my motives. My motive, Brian, was to actually just to understand how large the denominator was. It was a hypothesis, and I wanted to test it. I mean, that's what it said. The article said that, and it was actually kind of shocking to me that an article like this, which is to me was just like a putting forward a scientific hypothesis, would be met with this kind of vile attacks.
Yeah, it's almost like they wanted, for better or for worse, we have all these, trainings here in San Diego. I'm sure you have it in Stanford too, about, how toxic academia is and how, how awful it is. And undoubtedly, I mean, we're talking to somebody who had a toxic experience in academia, but I think they mean, typically more, the student experience, et cetera. Universities are racist, elitist, classist, and some of this is undoubtedly true. I mean, my home university was founded in part because of a need to de-anti-Semitimize the location where the university is. They wouldn't allow Jews to own real estate in the town where UC San Diego is located. You couldn't sell a house to a Black, a Mexican, or a Jew. And that lasted until the 60s, until Roger Revelle had the foresight to notice that Jonas Salk couldn't buy a house next to his laboratory. So that fell by the wayside. But so academia has always been rife with sexism and all these things. But when you advocate, the opposite point of view, when you say, look, we've made a lot of changes, oftentimes you are met with, and look, I'm a Jew, saying that we no longer have rampant anti-Semitism, even though we have instances on campus. It doesn't mean the campus is anti-Semitic. So the point is, it almost seemed like people wanted it to be a pandemic. Like we almost willed it to. I mean, how else can you explain, the vitriol, right? You're basically saying like, let's collect data and be agnostic. And maybe you didn't choose the headline. I don't think it's certainly that should be that controversial. It's a scientific question for a lay audience. So what do you attribute that to? The scientists, questioning your motives. You mentioned that happened in your Facebook defriending, which might ultimately be a good thing because you filter out who's really your friend.
I mean, these are people I love and respect. I've worked hard to forgive them in my own heart. I mean, maybe someday. It's going to be hard to forget that they acted this way. But there was many of them were just scared. I think part of it. We absolutely, I think in science, think of ourselves as, above the fray, but we're not really. Yeah. Like we're subject to the same kinds of biases in our thinking and our knee-jerk reactions and even prejudices that everyone is. We're still human, Ryan, right? Yeah. And I think that came out really clearly. The other thing around this, the scientists had already spoken up. Some of the primary, Tony Fauci, for instance, had already recommended a lockdown. These lockdowns had already been implemented around the country by March 24th when we wrote this piece. Right. We'd already been sheltered at home.
We started here in California 2 weeks to slow the spread, right?
Yeah. And this was like a week and a half into this. And then there was this sense, I think, of common purpose around the lockdowns, like this, at least in the university communities. Look, we're doing our best to work together to get rid of this disease. And here I am saying, "Lo, I don't know if we have the empirical basis to justify the lockdowns." Right? That's what I wrote. I said, let's do science to fix it, but it's not popular to do science when we're all in this together and we're all sacrificing together. Although actually lockdowns, I don't think are actually a common sacrifice. It benefits the relatively well-off in society, really hurts the poor. But that's something that was in the back of my head also. Mm-hmm. That the lockdowns were going to be really quite damaging for poor people, for children, for older people, for vulnerable people. Mm-hmm. So I didn't view these as costless. I think many people thought of, because okay, we just do 2 weeks. get rid of the disease, and then move on with our life. That was the story we were told. Mm-hmm. And in the middle of this, I'm saying, no, why don't we do a study to see if it's actually right to do what we just did? And a lot of people had put their reputations behind what we had just did. We'd asked the entire world essentially to lock down, to stop. It's an extraordinary thing for scientists to ask to do, and people listened. They did it.
We still have things here, in UCSD. We have to wear masks in classrooms up until recently. I taught this whole spring with the whole classroom was masked, except in the dining halls. We didn't have to wear masks. And I also noticed many times, during the pandemic, I'd be commuting, and I remember being at Stanford and seeing the same behavior. So I'm sure it took place there. Young men and women, prime of their lives, super fit, on their skateboards, going across the quad here or there.
No helmet, but a mask.
No helmet, mask, and on their phone, Jay. Incredible. And the risk assessment. Yeah.
There's something very good about that, actually. I mean, we make fun, but honestly, there's a deep empathy underneath that behavior. They're afraid, not for themselves, but they're trying to protect their older professors or something, or their grandma or something.
Right.
There's some empathy underneath this. Public health weaponized that empathy, unfortunately, I think. They used people's, especially young people's, natural desire to do good to gain compliance with behaviors that actually didn't have a scientific basis underneath them. Or had a very inadequate scientific basis, I think, underneath them. So I think that's part of the legacy of this. The other thing I found was there was some aspects of professional jealousy, and it was why am I running the zero prevalence? I do research in health policy for a living. I analyze data. That's my job. But I don't generally go and do zero prevalence studies. This is the first one I've ever done. Mm-hmm. Right. So why am I the one doing it instead of somebody else who's experienced running these kinds of studies doing it? Mm-hmm. I mean, I personally, at this point, would have been quite happy to have the CDC run the seroprevalence study.
Yeah, right.
This is what I was calling for. In effect, in this, you can see that this is the last sentence of the last two sentences of the op-ed. Universal quarantine may not be worth the cost imposed on the economy, community, individual, mental, and physical health. We should undertake immediate steps to evaluate the empirical basis of the current lockdowns. I thought the CDC would run this study. That would have bleeded away the controversy, I think, because that people view the CDC as a legitimate scientific agency with very serious people. It is a legitimate agency with serious people. That's just they made tremendous mistakes during the pandemic. Right. At this point, though, I had no doubts about the CDC's capacity to run such a study, but they just didn't do it. It fell on me in part because I wrote this op-ed. It wasn't something I was seeking.
Right.
Anyway, so we wrote this, and we actually did the study.
Yeah.
In early April 2020, we collected about 3,000 samples from Santa Clara County. It was really hard to run this during a lockdown because people were afraid to come out to get their blood collected. Right. We couldn't get an agreement to go into nursing homes, so we only did a community sample. Sampling was even hard, right? So we did this Facebook sampling, which turned out to be very controversial because what it ended up doing is it pulled more people from the richer parts of Santa Clara County, whereas the poorer parts are less likely to be on Facebook. They didn't sign up, so we had to do some reweighting to try to get a population level. There was also controversy over the test kit that we used. The test kit actually turned out to be quite good. The FDA eventually approved the test kit for emergency use. It had a false positive rate of 0.5%. Which doesn't sound that high, but if you have a very low prevalence, there's some possibility that if all false positives, some very small possibility. We corrected for that in the statistics. The original version, we put this out as a working paper, like a preprint, which then led to all these people saying, look, you got all the math wrong, you did everything wrong. When I put this out, there was a whole, the world blew up again. I started getting again, more death threats, more attacks. There was a lot of media attention, some positive and some quite unfairly negative, which I'll talk about in a second.
When was it submitted though, Jay? This was published in 2021. So
yeah, so we submitted it to 4 different journals, and they after the media attacks on us, we basically couldn't get a fair hearing. We revised. I have to say, the preprint process I found actually quite good. I was really pleased with it in a scientific sense. So we got help from world-class statisticians on how to redo the standard. There was an error in the very first version of it, and we corrected the error in a week thanks to help from countless scientists around the world. We wanted to measure the false positive rate of the test kit we were using to look for antibodies, right? It's a very important number.
Yeah.
The manufacturer had given us a study out of I think it was like 400 people that they'd taken stored blood from 2018, more or less, and then run the test kit against it. Now it should be negative because there's no COVID in 2018. Right. So any positives you see are false positives. And in that stored blood study, they came out with this 0.5%. It turned out, and we found out after we released the preprint, that there were labs around the world that were trying to check the false positive rate of this antibody test kit. And they sent us their results for use in our study.
Wow.
And so we went from like 400 samples checking for false positive rate to like 3,000 samples in a week. It's just people just shared the result. This was how science ought to be done. We're working together as scientists to help each other understand the physical world. And the preprint process was really fantastic for that. It also led to like a lot of bad things. Like, there were all these Twitter attacks. There was by the way, I think science really needs to be replicated. Yep. So this, I really like the study. I think we got the result right. I'll tell you the results in a second. But we did another seroprevalence study in LA County the week after that, 10th through 11th of April, with the same test kit, but with a very different sampling scheme. Here we hired a professional firm that had a representative sample of LA County, and we sampled them. And so we had no fight over whether we had the representation correct. And I'll tell you the results. So the results were, one, there were, do I have it here? 50 times more infections than cases. 50 times more infections. For every person that had been identified by public health as being positive, there are 50 people or 40 people walking around LA County or Santa Clara County that had tested positive, that had antibody positive, meaning that they had been exposed to the disease, recovered. Many of them, like maybe 30% of them, didn't even remember ever having symptoms. So this disease then produces a very wide range of clinical outcomes. No symptoms at all. You just recover, not even knowing that you were sick, to these horrible, severe viral pneumonia that's killing people. Right. But we were focused on the viral pneumonia when, in fact, there was a big, sort of iceberg underneath of lots of people that had this. There's three lessons from this. One is that the death rate was 0.2%. 99.8% survival in the community. Now, we didn't sample nursing homes; it's much higher there. Right. The second, the disease was already too far gone in early April to stop it. 3% or 4% of the population had already had COVID. That means the zero COVID. If you may as well forget about zero COVID. This disease is here to stay, and it's likely to infect a very large fraction of the population before it's done. We knew that in early April 2020. From this study. And then the third thing, it's only 3 or 4% of the population that we measured having this. That means the disease still has quite a long way to go. We're in for a long epidemic. Right? Those are 3 lessons to be learned from this. And I don't think anyone wanted to learn any of those lessons because from the hate mail I got from these studies. This paper was published in the Journal of the American Medical Association, the LA County one, which we didn't release through a preprint process. And so it didn't get quite the same notoriety or controversy, but it was the same, very similar methodology, and went through peer review and published in one of the top medical journals almost immediately, with me as a senior author. So it's one of these things where I thought we were doing good science. I still think we did good science here.
What could possibly be political? A month after this, it was advocating against. This isn't even advocating against a lockdown. It's a key scientific fact that we need to know to decide whether a lockdown may be worth it or not. I had Eric Topol on the podcast about a year and a half ago, when we were still in the Delta wave, I think it was. And, I didn't really push on him as hard as I probably should have. It's hard when you're talking to somebody and you want to establish a rapport and you want them to speak freely and not feel like they're on 60 Minutes. But, one of the things I'm embarrassed to say, I really didn't push him hard on his political involvement in the release, choosing effectively to advocate, at least, he wasn't in control of it, but he advocated against releasing the results of at least the Pfizer BioNTech vaccine results prior to the election. And part of it was, at least it reported in the public. I can't, vouch for this, and maybe you know more about it, but there may have been political ramifications around that. And I didn't ask him about that. But if I could go back and do the interview again, I would ask him, if this, as in he's a huge proponent of the vaccine, as he and I did speak about, but given that there were people that didn't take the vaccine because it was not released until after the election, or results, at least the results of the trial study were not released until after November 9th or 8th of 2020. That means people died, right, Jay? I mean, people died that could have been saved. You're not an anti-vaxxer. You're vaccinated.
I advocated for the vaccine.
You advocate for the vaccine. So that means people died, right? Because let's just take Eric out of it. Okay. So let's just say people that didn't want the vaccine and said, I won't take a vaccine, the Trump vaccine. Then isn't it safe to say that people died because of for political basically purposes? I mean, you can't have it both ways. You can't say the vaccine worked and say it was a good thing to withhold the vaccine for any period of time during a raging inferno. It's like withholding a fire extinguisher. Am I wrong?
Well, just to defend Eric, although I think he is a good scientist and he's tried his best. But I agree with you that he politicized his science and his advocacy in a way that was really quite harmful. But just to defend, when you release, when the FDA says, look, we have enough information to recommend that to allow a firm to market some product, you have to have some confidence that they've done this testing right. And so in principle, you could say, well, look, Eric's just saying, let the FDA do its work. Don't let there be political pressure to release the study early or whatever. That would be my sort of attempt to try to defend Eric. I do think, though, that wasn't just all of it. Like I actually worked with the FDA on vaccine safety for almost a decade, helping them with like measuring, setting statistical systems to measure vaccine safety and drug safety. I mean, there's some great scientists there, but the pressure on the FDA on both sides was really truly something horrible to watch. I think, like, for instance, now they've been very slow to release data on whether the vaccines show safety signals. That undermines confidence in vaccines when you see an agency that's just not supposed to be political,
right,
act politically. And it's also the same thing for scientists. For scientists to act politically when in fact we're just supposed to try to just follow the data, no matter where it leads for politics. So I think, like, when Eric wrote that letter encouraging the slower release of the vaccine data or the FDA approval of it, it really struck me as political. Mm-hmm. It struck me as like he was more concerned about Trump winning than he was about whether
that's what I'm referring to. Yeah. But I guess I want to push back on you with love and respect, but say, if you could do it again, Jay, knowing that the results that you published in the 2021 study that were done in 2020, and then this study that's currently on the screen, these had life-saving potential. They may have been tainted. The acceptance of them, the hate mail, death threats, those may not have happened. Of course, counterfactual history is impossible, but we have a multiverse in cosmology. So let me just ask the question: do you regret publishing the op-ed in that it may have, biased, ordinary, clear-headed people to reject the work of you as an eminent scientist and your many, many colleagues? Two different studies showing the same thing. Do you regret the op-ed? Do you feel like it was counterproductive in the long sweep of history? Would you do it again?
I would do it in a heartbeat. I didn't have a choice. Like, I had a hypothesis that I thought was very important from a scientific perspective and also a policy perspective, not politics, but policy perspective. Mm-hmm. That's my job, Brian. I mean, it's like you having an idea about where to look in the universe to resolve fundamental cosmological questions. You'd have to do it. It's just part of who you are. Yeah. Right. You have to try to follow through. The same thing with here. This was my job. Like, this is the purpose of my work was to have hypotheses like this and test them, no matter what the costs are. To me personally, that is. Yeah. So I would do it again in a heartbeat. Mm-hmm. I mean, the politicization was, by March of 2020, people were already like, Trump had already screwed up everything, and there was in this environment where, especially in academics, there's a lot of hate for Trump. Yeah. I think it sort of colored people's thinking about this. And so, like, people saw these studies, and when Trump had said things like, well, we don't want the cure to be worse than the disease, right? Meaning the lockdowns, you don't want to do lockdowns if they hurt people. I mean, just because Trump said it doesn't mean it's wrong. Right. I mean, that's absolutely true. You don't want the cure to be worse than the disease, right? Mm-hmm. And so I think there was this, like, sort of, especially in the scientific community, this knee-jerk reaction against Trump as if he were some uniquely bad thing.
Right. And therefore anybody who sided with him or aided him became tainted with the taint of Trump, the scarlet letter T, including you, I think. I mean, I saw you in the public long before I met you advocating common sense. You're very sober. You have a gravitas. You're, if I had to define you, I know you're a God-fearing man. I know you're a wonderful, devout Christian, family man, but I think of you as scientist. And by the way, that's a compliment for me because I don't think most physicians are scientists, at least the ones that I teach, that kind of say like, will this be on the test? And it used to be that physicians and physicists, there was an actual connection between the terms, but it really has dissipated. But I think you are a true scientist at heart, and you're a doctor second. And I'm not diminishing your role as a doctor, but at all. I'm just saying
I'm primarily a researcher. That's where my inclinations are. I don't see patients, Brian. What I do for a living is I do research for a living. If I'm not a scientist, then I don't know what to call myself.
Yeah, exactly. All right. Yeah. So let's, so after this study, then that's
what happened next was really kind of shocking. So I'll get back to this.
Yeah.
There was a series of articles, May 2020, April 2020, by this. I just picked on this BuzzFeed author who's actually she was obsessed with me. I called my friends and I started calling her Javert after the Les Mis, like the inspector in Les Mis or whatever. I mean, she wanted to create a scandal around the study, around any activities. So involved in the study was this man named John Ioannidis, who I believe is the most highly cited author in existence that's still living.
Yeah.
I mean, he is an amazing man, truly one of probably the smartest man I've ever met. I mean, he had an incredible energy. He had written, for instance, to expose Theranos, the Elizabeth Holmes fraud very early. He wrote a paper in 2005, essentially saying, look, 95% of all published medical studies are wrong. Mm-hmm. And you know what? You read the paper and you're like, at the end of it, you're like, yeah, he's right. 95% of all medical studies are wrong. It's like a 5-page paper or whatever. And he's just a brilliant man. And as a result of his work, there's been this like replicability crisis that's, I think, improved, psychology, economics.
Yeah. I spoke with Guido Imbens at Stanford, Nobel laureate, about that very topic. And this called the credibility revolution that he in part won the Nobel Prize for. He's exactly correct. Yeah.
Yeah, so I think John Ioannidis was the fact that he was in this study. He'd also generated a lot of enemies through his career because he just called out bad science. Yeah. And many of them stuck their heads up to try to get back at him. And he was a senior author in the Santa Clara study. Funny, it's like the Santa Clara study got all this like nasty attacks. The LA County study, where he wasn't an author, didn't get nearly as many nasty attacks. I mean, it's kind of a clean experiment, if you ask me. But anyways, what happened was that this BuzzFeed author, she decided that we were bad guys.
Yeah.
So one of the things for that Santa Clara study was a big community of people that tried to help. Like my wife, for instance, volunteered to help. We couldn't find any place that would allow us to have this, we had this drive-through finger prick check of blood draws, right? So
people were washing their groceries. I mean, let's not forget this. People were going totally nuts. And I actually have a theory, Jay, that part of it was because of the movie, Outbreak or Contagion?
Outbreak, yeah.
The one Matt Damon won. Because all that stuff, and you could just see these journalists, watching that movie. Oh, there's fomite and there's this, and it all of a sudden became in the literature. And what were people doing during the pandemic? They were watching Netflix. And what was the most popular movie? Contagion. And there's so many things in that from the transmission, the zoonotic, that all I think got imprinted on a base layer in these journalists' minds. And as opposed to doing real sound scientific research and verifying, checking sources, et cetera, they relied on kind of that pop knowledge. But anyway, I don't want to derail you where you were.
No, I mean, that's exactly what happened, right? I think because, and so people were scared to sign up for their study because they didn't want to be face to face with someone drawing blood. So what we did is we had this drive-through blood draw. So people drove up, they stuck their finger out the almost closed window, did a little prick, got a little blood prick, and then they drove off. And it was hard to organize. We had to get my church agreed to let they use our parking lot as a drive-through. And my wife helped arrange that. And my wife's a physician. She wrote this email to my kids' middle school listserv. Mm-hmm. Without asking me. She was doing this because out of her sense that she wanted to help. But she actually to asking people to sign up for the study. Now we had a Facebook sampling scheme. I really didn't want people to randomly sign up. Stanford professors were calling me wanting to sign up for the study because they wanted to know their antibody antibody levels. And I had to say no. I myself never checked my antibody levels till months later because I felt like we had such a scarce resource in these antibody test kits. Anyway, so Stephanie Lee, this BuzzFeed author, made a scandal out of it. Somebody leaked that email that my wife sent to my kid's middle school listserv, and she made my wife into this bad guy. A Stanford professor's wife recruited people for his coronavirus study by claiming it would reveal if they could return to work without fear. Because she made the claim that if you have an antibody, it's likely that you're immune. Mm-hmm. In that, now, turns out that having antibodies, being exposed to COVID and recovering does provide immunity. That's absolutely true. But
which, by the way, Fauci said he was ignorant on that question, and not, one way or another, not stupid, but just he was agnostic. They didn't know as of last year, I believe. In other words, they had never done a natural immunity study. And to my knowledge, I don't know if the CDC or N8 or whatever the agency is, have they ever done a natural immunity study?
Yeah, they finally acknowledged it relatively recently, shockingly, because by late April. When this BuzzFeed author wrote this thing, it was still quite controversial whether there was immunity or not after COVID recovery. But by the middle of the summer, it was really clear from reading Cell and Nature, the studies in Cell and Nature of immunity, especially cellular immunity, was pretty strong after you COVID recovered. That question, there was some uncertainty, I think, in April, not so much uncertainty by July of 2020. I basically decided from reading that literature that there was pretty solid evidence in favor of. I didn't know how long it was last. That you need long-term epidemiological studies, but now we've had them. It seems to last up until you get a new variant. But even if you get a new variant, the second time you get it is likely to be less severe than the first time you get it.
Right.
Anyway, so she wrote this study, and I got to tell you, Brian, I was filled with anxiety. Now, all of a sudden, my wife was this national negative story. She's now brought into this. She's just a civilian in this fight. Well, it's one thing to attack me. I mean, I wasn't really emotionally prepared for that either at the time. But to attack my family, I felt like my life was out of control. I couldn't protect my own wife. I was worried about my kids because now I have this notoriety, and maybe their teachers or someone will take action against them, or worse, I'm getting death threats. Right. I lost 30 pounds of anxiety weight. I mean, I could have stood to lose it, actually, Brian, I have to say, to be honest, but that's not the right way to do it. Within a month and a half, I'd lost a tremendous amount of weight. I couldn't sleep. It was really, really, it was a dark time for me.
Of course.
She wrote another piece saying JetBlue's founder helped fund a Stanford study that said the coronavirus wasn't that deadly. Now, the study, we ran it for about $100,000, which is very cheap for a study of that size. And it was funded by small dollar donations to Stanford. I didn't take a single penny for the study. And Stanford knew this. That one of the people that donated to the study was this man who founded JetBlue. I had a couple of conversations, but he wanted me to run studies in New York City, but I didn't have the infrastructure to run studies anywhere other than just where I happened to have local connections like LA and Santa Clara. So that didn't go anywhere, but he was very generous. He gave $5,000 to Stanford for the study. Somehow that turned into this weird conflict of interest. It's normally how studies are funded, like this anonymous gift account given to Stanford.
Yeah.
I'm not going to change the result of my studies because the JetBlue founder gave $5,000 for a $100,000 study. It's insane. But that was and she wrote it, a Stanford whistleblower complaint alleges.
Right.
Stanford then took that and started, first they called it an investigation, but then very quickly they called it a fact-finding thing, saying we didn't do anything wrong. They just wanted to find out what happened. It lasted months. I hired lawyers. I was really, I've never had anything like this happen. I'm a faculty, full professor in good standing.
Yeah.
To have my university take this kind of slur seriously was really a shock to me. During that, they questioned basically everything. During the summer, I wrote a piece, I'll show you here, on the futility of contact tracing. Because if you have a highly infectious respiratory virus, contact tracing is really useful if you can identify easily who gave it to you. The disease isn't spreading rapidly. I wrote this piece saying, look, if you have a disease like this, contact tracing is not going to work to stop the spread of it. It just seemed like a reason, just such an easy thing. It turned out to be correct. Now, everyone understands the contact tracing programs didn't do very much in retrospect, but at the time, this was somewhat a controversial thing. This is published in September, but I wrote it in July, and I gave some public appearances on this in July and August 2020. This was part of their investigation. Why did I talk about contact tracing in this negative way?
Yeah.
I'm a faculty member. I thought I had academic freedom, and yet Stanford treated my my professional opinion about whether contact tracing is useful as something that to investigate me over. They investigated the study, knowing full well that the study was funded appropriately, that there was no conflict of interest in how the study was funded.
Yeah, what's the implication that, the founder of JetBlue, who's no longer involved in the company on a daily operational budget, that somehow this will redound to his benefit, and that you knew who funded your research in a pooled set of donations to the third wealthiest campus by endowment size in the world? I mean, it's preposterous.
It was truly a shocking thing. I mean, as I said, I hired lawyers. I was again filled with it. It was a very anxious summer. Actually, I have to say, like at the end of it, even before the end of it, I'd come to terms with this. I was like, okay, this is just the way life is going to be. I have to just accept that basically everything I say is going to be seen in this this conspiracy way, instead of like the good faith method, the good faith in which I meant it. Like if we'd found, for instance, that COVID was 3.4% mortality rate, I would have reported that. I wanted to know the truth. I really desperately wanted to know that number, because the right policy depends on knowing that number. John Ioannidis organized a group that he wanted to he wrote to President Trump's and said, look, I want to offer you some outside scientific help. And he organized a group of scientists to go visit with President Trump, including people who were very much in favor of the lockdowns. Mm-hmm. That group included both pro and anti-lockdown scientists. He wanted to give President Trump a full view of what the scientific range of opinion was about COVID. Definitely made it into a big deal. Yeah, as if somehow it was like weird that scientists would want to go inform policymakers on this key scientific question, presenting fairly what the range of scientific opinion was.
And I like the lead group of scientists. At least he compliments you.
I mean, whatever. The whole thing was just, and then this is after this. She wrote a piece after we wrote the Great Barrington Declaration about how we were calling for herd immunity, which is such nonsense. Well, let me tell that story in just a bit.
All right.
So there were 100 of these seroprevalence studies that were done. They all basically said the same thing. And the key thing is not even the death rate itself, but the spread in age as a risk factor as the death rate. Right. So you have for kids, the survival rate is really, really, really high, 99.999. Just a very large, very, very high number, pretty close to 100%. For older people, it's quite a deadly disease. Especially in nursing homes, institutional, so 70 and up, 94.5% survival. That's a low survival rate for a single infectious disease. And in fact, that's come to pass. That's the predictions of these studies. 80% of the deaths have been people over 65 worldwide. Right. And for kids, it's likely that even before we had the vaccines, it was less damaging than the flu for kids. The lockdowns for the kids is a really bad thing. So I think it's one of these things where I don't know what to say. It was shocking. But scientifically it was quite nice. We had a replication of our finding in real time. Within a year, we knew that we were right from 100 other studies. Mm-hmm. Now let me tell you the story of this Great Barrington Declaration.
Did you ever get an apology from Stephanie?
No, she still thinks we're bad guys. Mm-hmm. I think it's just really hard to do science in this kind of environment. And you'd think science writers would try to make science easier to do, not harder, but that's not what happened during the pandemic. So the Great Barrington Declaration, that was a thing that I wrote in October of 2020 with Martin Kulldorff, who's on the left over here, and Sunetra Gupta. We wrote this thing because what we wanted to do is this was aimed at the public. It wasn't less aimed at scientists. We wanted to tell the public. At the time, it was like we could see another lockdown was coming. We knew that there was going to be another wave of cases and that people were going to react with as a lockdown. There was a sense there was an illusion of consensus that all reasonable scientists were in favor of a lockdown. What we want to do is we want to tell the public, no, there are reasonable scientists that disagreed with the lockdown policy.
Right.
Reasonable scientists with credentials. So we wrote this it's like a one-page document. Tens of thousands of scientists signed on, epidemiologists signed on, almost 1 million people signed on. And the idea was, the idea of the Great Barrington Declaration is we advocated for focused protection of older people. Those are the ones who are at high risk. move heaven and earth to protect them. At the same time, the lockdowns are hurting younger people. I'll show you some evidence on this in a second, but like in poor countries, the lockdowns, essentially what we did is we disrupted trade ties. In poor countries where the poorest people live, it's that the point, the end of that policy is that they lose their jobs. $2 a day or less of income, they go into dire poverty. They starve, their kids starve. And our kids in richer countries, you stop schooling for even a short time. That has long-term consequences on their lives. They're less well educated. So that means they're going to be poorer their whole lives. They're going to be less healthy, and they're going to live less long. We robbed our kids of life years with this school closure policy that we adopted. And so the lockdowns, we thought, were quite harmful for the less harmful for less vulnerable people. For more vulnerable people, you want to move heaven and earth to protect them. Focused protection. That's what the Great Barrington Declaration was. And we wrote this as an alternative to like letting the virus rip. We're not calling for letting the virus go everywhere. We wanted to protect older people from this, from the virus. But we also thought the lockdown policy was a mistake. We wrote it on October 4th, 2020. Within days, tens of thousands of scientists signed on. Better protection for older, high-risk people. Young adults may live near normal lives as best you can to minimize the collateral damage from the lockdowns. Let kids play with their friends. Let them go to school. Let them have something close to a normal life. Yeah. Or else we're going to harm them. Okay. Now, I was much more emotionally prepared for this because I'd already been through the fire in April and the summer of 2020. So I knew there was going to get attacks. What I didn't know was who was going to attack. 4 days after he wrote the Great Barrington Declaration, this is Francis Collins. He's the head of the National Institute of Health. Just to give some context to your listeners, someone like Francis Collins plays a pivotal role in the careers of biomedical research scientists. He sits on top of tens of billions of dollars of money that goes to biomedical research in the US and elsewhere. But it's more than that. In order to get tenure at a place like Stanford University Medicine, you basically need to have an NIH grant. It's a signifier of success. It's like an NSF grant maybe in cosmology or something. I mean, I just don't. The equivalent is hard to say, but it's really quite important in the social status of scientists in biomedicine. He wrote this email 4 days after he wrote the Great Barrington Declaration, and let me just read it to you. Hi, Tony and Cliff. Tony is Tony Fauci. Yeah. Francis Collins writing to Tony Fauci. This is the Great Barrington Declaration site. This proposal from the three fringe epidemiologists, Harvard, Stanford, Oxford, mind you, with the Secretary of HHS, seems to be getting a lot of attention, even a co-signature from a Nobel Prize winner, Mike Levitt, at Stanford. I mean, it's fringe because a Nobel Prize winner signed on, if I understand correctly. There needs to be a quick and devastating published takedown of his premises. I don't see anything like that online yet. Is it underway? I started getting calls from reporters almost immediately asking, why did I want to let the virus rip? Why did I want to kill grandma? What was wrong with me to suggest that this fringe idea? New York Times wrote this basically a hit piece, a really quite unfair hit piece, essentially saying, and the idea was that you couldn't do focus protection. It's impossible to protect it. You can lock down everyone, keep everyone safe, but you couldn't keep old people safe. But that's crazy. It's actually not true. Sweden had actually followed up after a disaster in Stockholm early in the pandemic. They followed a policy of focus protection that after that disaster actually did manage to keep a lot of their older population safe. Trump wants to try for herd immunity. Without a vaccine, it could kill millions. These are fellow scientists writing this. I mean, it was truly because
Michelle Walensky is the co-author.
Yeah, the CDC director, the now current CDC director. What I wanted was a conversation among public health officials to say, how should we protect vulnerable older people? It's going to be very different in LA County, versus in, Billings, Montana or something. You need local public health to weigh in, who understand the living circumstances of the older population where they are, and devides local policies that are sort of tailored for the local population. That's what should have happened. A detailed conversation. Instead, you had this crazy idea that we were trying for herd. It doesn't make any scientific sense. Herd immunity is the end point of this pandemic. That's just how the other coronaviruses are controlled. The other coronaviruses, you have a sufficient fraction of the population that have had it. You can have it again. Protection doesn't last forever, but you get this decoupling of cases from deaths. That's what herd immunity looks like for coronavirus.
And isn't lockdown of everybody implicit in that lockdown of elderly people? So why would it be harder to lock down fewer people than to lock down more people?
I mean, we weren't even calling for a lockdown. We were looking.
I'm not even saying lockdown, just like
but you're absolutely right. you're absolutely right. It made no logical sense other than to say, other than that just they didn't like us or something. Fringe epidemiologists, we were trusted colleagues saying, look, there's not a consensus here.
You and I were in Galileo's house, his final house / imprisonment location. And we both remarked, it wasn't a bad place to do a couple of year stint as a prisoner, compared to that. I think Jeffrey Epstein would have loved to trade places. But while we were there, we couldn't help think about, well, what did Galileo face? When he is facing, a modern day, a latter day version, earlier day version of an inquisition. And I'm actually calling this episode a scientific inquisition because there's so many, I don't think a general, as you say, you're tenured, you have multiple degrees, all from Stanford, your career, and I'm not minimizing because you had huge repercussions to your career. I mean, you could have been terminated, you have health insurance, you have all sorts of things that you depend on your career for, and you should, and you have every right to. But there are younger people on all of these articles and younger people doing good science. Now they are tainted with this scarlet letter F, not for Fauci, but for Fringe. And that's devastating. And I don't even think the results can be known. I don't even think it's knowable. I don't think Francis is going through and putting his finger on the scale of every proposal. But when you say, is there a coordinated, it's a conspiracy. I mean, that's the definition of a conspiracy, right? People breathing together is what it means. And breathing here to, coordinate with the number one person in the world who is the face of this pandemic and leading the marshaling of resources. Now his quotes are accurate, but will not be appreciated by the White House.
Yeah, I mean, he's calling us fringe epidemiology. I mean, it's just such an irresponsible use of his power, Brian. It's such an irresponsible use of his power. If he didn't agree with us, he could say why he didn't agree with us. Not calling for. I mean, they use the press to attack us, to smear us, to essentially push us to the fringe. And why? Because they wanted to create this illusion that they actually was a scientific consensus when there actually wasn't one.
Right. And by the way, I don't remember, millions not dying, Jay. I remember, I think the death, I remember very vividly the front page of the New York Times with 100,000 names, very powerful, very moving. We're up to 10 times that. I haven't seen any, full issues of the Washington Post with everybody's name on it. Why is that?
I mean, this got linked up in politics really very quickly, didn't it? Tony Fauci, I think, worked to undermine President Trump. There's just no other way to put it. And I just, that's unfortunate. He's a scientific advisor. He's not supposed to take political sides. And he did, right? They're talking about how they're going to manipulate the White House. They were scared about us not because of anything other of like we were right or wrong. They were scared of us because they were afraid the illusion of consensus that they had, that they were the science, they knew what the scientific thing to do was, had been shattered. You have Nobel Prize winners, you have doctors and epidemiologists from Stanford, Harvard, Oxford saying, look, no, we disagree. That should be a call to scientific discussion, not a call for devastating takedowns.
Yeah. And then have it, tacitly, what you say is absolutely correct. I mean, it's chilling, to think about that. I want every scientist who's watching, imagine your research proposal. And we have people in my field, by the way, Jay, that claim they're being censored by the big cosmology and NASA. And there are people that propose, flat Earth observatories and so. Okay, so there has to be some level. But just every scientist, and I have many of the Nobel Prize winners that have been on the show and honored me by coming on, they're watching this right now. Just imagine, your next proposal, whether it's to your university, whether it's to your, to your funding agency. Imagine, just forget about the politics, just that the grant director thinks of you as a fringe, as a nutcase, as a crank that not only, it wasn't that you need to be ignored or we need to bring the scientific fact. No, that you're a crackpot and you need to be taken down. I don't care what branch of science you pursue. I think it's really quite chilling. And the fact that they're still in position, even though, let's say they were right. I don't think that they were right, but let's say they were, to do this and have it revealed via these really damning messages. I think that they shouldn't be fit to serve in this capacity. And I'm sure that's controversial to say, but that they're still there and that they're retiring and they're going to get their benefits and so forth. I think scientists should be outraged about the way you were treated.
Well, I think they abdicated the responsibility they had to treat the power they were honored with, to treat it responsibly, right? So if you're in that position, Brian, what you would do is you would bring me in and have a discussion with me. And if let's say you disagreed with me, you'd say why. And if it made sense, we'd like air our differences publicly on the substance of it. You're not going to use, like, what happens when Tony Fauci does this is you're absolutely right, just sends a signal to all the other scientists in biomedicine that if you step out of line, if Tony Fauci says, I am the science, if you disagree with me, you're disagreeing with science itself. If you step out of line, your career is at stake. That's just shocking, right? So you're right. There needs to be obviously some level of gatekeeping. You don't want every crank idea, but this was not a crank idea. These were prominent people in respected institutions saying, look, this policy is wrong. Yeah. And in retrospect, the policy was wrong. The disease spread everywhere. We still also got the collateral damage from it. I think it's just an irresponsible use of power, and I agree with you. I don't understand, and it frankly it shocked me because I deeply respected Francis Collins and Tony Fauci before the pandemic. I still have a textbook from Tony Fauci that I learned internal medicine from. And Francis Collins, he's a very prominent Christian and also a prominent scientist who did amazing work with the Human Genome Project. Yeah, it saddens me to have to say negative things about him. I can't help but respect him deeply.
Let me ask you a couple of other questions. I know your time is very limited, but there's a couple of big picture questions I want to ask you if you have 5 more minutes left, Jay.
Sure. Yeah.
The first one is revolves around the recent op-ed you wrote in Newsweek. Where do you see things going, with President Biden? Do you think there'll be a shift after the midterm elections? Do you feel like the policy is sort of, we've reached a point where we're coming to people are saying, even Joe Biden said that, the pandemic is over, but we're still dealing. I don't know. He said something like that. Where do you see that going? And then I want to ask you about this amnesty proposal, and then we'll close out with some existential questions. So first, the Newsweek op-ed that you wrote last week.
Yeah. So I think whether it's Biden or somebody else, we have a choice to make. There's 2 ways I think we can deal with future pandemics. One is what we did previously, which is we did work to try to bring viruses from the wild into labs, play with them to see if they have pandemic potential, try to develop vaccines early, and then try to deal with the pandemics as they come up. The idea is to prevent the pandemics, and if they happen, be prepared to deal with them. It's quite likely, or certainly possible at least, that this pandemic may have been caused by that very research. If there's a lab leak, it's because somebody brought a bat virus that's very close to SARS-CoV-2 into a lab, played with it, gave it the capacity to infect humans, and it leaked accidentally. That's I'm not saying that's happened for sure, but it's certainly a live hypothesis. And if that's true, that strategy of dealing with pandemics we'll have that forever with us if we keep that. Or the other path we can just say is not do that. We go back the old way, and sometimes pandemics happen every 30, 40 years, and just have to try to cope with that fact.
Right.
The other thing though, once you have this strategy of having this like vaccine ready pandemic, the Biden plan says within 130 days we'll have a vaccine and we'll send it out to the population as soon as there's a new pandemic happens. The problem with that is that it takes longer to test a vaccine than 130 days. You need very large samples of people, tens of thousands, maybe hundreds of thousands of people, depending on the sample, the statistical power, to test it. You want to test it for a longer period than just 3 months to see if it works. You want to know if it stops transmission, who it protects, side effects, and so on. It's going to take longer. During that time where you wait for 130 days for the vaccine, there'll be a tremendous pressure to lock down again.
Yeah.
So that's one path. Study vaccines, study these viruses, bring them out from the wild, maybe cause the pandemic, and then lock down every time we have it for hopes of finding a vaccine that we hope works after 130 days. The other path is a much more restricted set of research to try to prepare for pandemics by general vaccine research, general antiviral research, not specific ones to enhance the capacity of viruses to infect humans, and not by promising 130-day effectively a vaccine program that undermines the ability to actually test vaccines appropriately and potentially undermines the trust in vaccines. I think those are the policy choices very starkly that we face. And whether it's President Biden or somebody else, those are the choices we're going to have to make in the next few years, I think.
Yeah. And then the last topic before we close out has to do with this recent proposal by, I think, a professor and maybe some other colleagues of hers. And that was we need a period of what we call in Hebrew teshuvah, repentance, and maybe forgiveness. And she called it, I think the title is amnesty. We need an amnesty for what we did and said, in Vegas, shouldn't stay in Vegas, what we did and said during the COVID pandemic. I always love that in Vegas, what happened, like God doesn't know what's happening there. But anyway, so God knows, what should be done. But what do you make of this call for amnesty?
So it's a Professor Emily Oster, who I actually was friends with before the pandemic, still friends with. I still have a deep respect for her. Right. And during the pandemic, she's done some really constructive things. Like she collected data on the safety of school reopening and played a pretty central role in pushing for school reopening in the United States. At the same time, she's called for things I disagreed with. Like she called for vaccine mandates, which I think were quite harmful because I think it bred distrust in vaccines. Now, I think the call for amnesty is hard. I very strongly believe in forgiveness. I'm called to forgive. I mean, this is one of the things that my religious upbringing says. Like even people that haven't asked for forgiveness, I'm supposed to love my enemies, Brian. Right. And so, like, how do I do that? I think the way I think about this is you have to have forgiveness for people, but not amnesty for systems. Right? We have to have an honest conversation about what went wrong. We have to have an honest conversation about so that we can do reform so that what went wrong doesn't happen again. And it's going to bruise the egos of some people. That's inevitable, but that's how you do system reforms. I personally will work very hard in my own heart and mind to forgive those people that have harmed me. And I call for everybody else to do the same. We need some kind of reconciliation. A lot of mistakes happened. A lot of it was because of fear. A lot of it was because of uncertainty. And those are all understandable. Let's try to work with each other in that spirit. Even Tony Fauci, I'm willing to forgive. Even Francis Collins, I'm willing to forgive.
But in Judaism, at least, you're called to forgive as well, but only on the supposition the person identifies what was done wrong, recognizes, admits it was done wrong, and also reconciles with him or herself to never do it again. And so only it's thought can someone's honesty really be tested if they're put in the same position. And unfortunately, they're very likely to be put in position. And so you don't have to react to that. But
the thing is, I think some people, we really need a new leadership, like leadership that essentially abuses its responsibilities, doesn't deserve to be leaders. I don't mean that personally. I mean, it's just like you need people in scientific leadership that have the capacity to do the right thing even when it's hard.
Yeah.
And unfortunately, I don't think that's true for all of our leaders. That's not the same thing as not forgiving them. I mean, I think there should be consequences for bad actions, and that may include loss of leadership.
Yeah, and just close with a quote from President Eisenhower. Of course, did a lot of amazing things, including starting NASA, and advocating against the blind acceptance of a what he called a military-industrial complex. And I wonder, he also said the following. He said, "Yet in holding scientific research and discovery in respect, we must also be alert to the danger that public policy could itself become captive of a scientific technological elite." And so I think we do need to pay heed to good old Ike and respect it, even as scientists who have the most to gain under a benevolent dictatorship of our technocracy, theocracy replaced with scientific theologians, high priests. And priestesses, we need to be careful of the power that we have. You say science to somebody, they're like, "Oh my God, you guys are so smart." And I always say I have to sing the alphabet song, to know what comes after Q. For God's sakes. Okay, Jay, we've reached the final 4 thrilling questions of the Into the Impossible podcast, kind of semi-rapid fire. But I want to ask you these questions, which all my wonderful guests have had the opportunity to answer. And the first one, they're basically advice to future generations and past advice to your former self. So the first one I always ask is, what would you put in your ethical will, not material will, when you spring forth the age of 120, or now you're so fit? I was like, the gain of function could be good. Like, I lost a lot of weight when I had COVID. I put it all back on since I was in Italy with you. You're forcing that carbonara pasta down on me. No, but in all seriousness, there could be some good gain of function, just not with pathogens, please. Anyway, what do you say that you want to leave in your, what we call in Hebrew, a zava'ah, an ethical will, that Moses gave, Jacob gave, Jesus gave on the Sermon on the Mount. And even Alfred Nobel has an ethical component. What ethical provisions would you like to give to future generations, both biological and ideological, of which I count myself as one?
I think each of us have been given our gifts for a purpose, intellectual gifts, moral gifts, even material gifts. And we need to remember that purpose is beyond us, and to use those gifts responsibly for that broader purpose.
That's beautiful. The next statement comes from the namesake of the institution of which I am the associate director, Arthur C. Clarke Center for Human Imagination here. And Arthur C. Clarke famously said, any sufficiently advanced technology is indistinguishable from magic. You're a very eminent scientist. Thinking scientifically, imagine you make a monolith like that in 2001, A Space Odyssey, the movie, and you could put anything on it that summarizes the greatest discovery, not made by you, although it could be, but the greatest scientific fact imaginable, to kind of have a little bit of braggadocio about what human beings are capable of. What's the most astonishing thing in your field, in any field, about our scientific universe?
I mean, in my field, we can heal people with the worst diseases that were before we never imagined we could do. You have cancer. There's so many cancers we can treat now. Cure. You have all these conditions that have plagued humanity for generations, for millennia, and we can fix it. We have to remember that even when we're doing that, we still can't stop you from dying altogether. I mean, it's amazing what we can do. We live so much longer than we once did because of science.
Yeah.
But at the same time, we have to stay humble. We still haven't conquered death. Yeah. We probably never will.
Absolutely. The next question is another quote from Sir Arthur C. Clarke. He said the following: when a distinguished but elderly scientist says something is possible, they are almost certainly right. But when they say something is impossible, they are very probably wrong. I'm not calling you elderly. You
got the gray hair going on.
I use a Sharpie, so it keeps me not being as distinguished as you. What have you changed your mind about? What, if anything, have you felt I was wrong about in your scientific work?
I think, just on COVID, there's been a lot of things. Probably the most consequential thing I got wrong was that in March of 2020, I thought there was no way to get a vaccine in a year. No chance. Because normally, my understanding was it would take a decade to find the right target for the vaccine, and then quite a long time to test it, a year or more to test the vaccine. Yeah. The fact that we could get the political will and the scientific capacity to produce a vaccine so rapidly blew my mind. I'm still amazed by it. Yeah. And so I kind of was pleased to be wrong about that. I do regret how the vaccine was used. I think it could have been used for focused protection of older people. I'm very strongly in favor of that. Yeah. But it also was used to divide the population, to create shame for people who had some reservations about taking it for whatever reason, and essentially to discriminate against people. And that, I think, is to be regretted. But that was the social use of the vaccine, not the amazing technical achievement of getting the vaccine in such a short time.
All right. And then the last law of Arthur C. Clarke states the following: the only way of discovering the limits of the possible is to venture a little way past them into the impossible. And that's the origin of the name of my podcast. I want to ask this in a form of advice to your former self. What mysterious aspect of life maybe perplexed you as a 20-year-old or 30-year-old, but later in moments of great clarity through inciting incidents or breakthroughs led you to become the person that you are, a person of great courage as well as great intellect? In other words, what would you tell that 30-year-old, 20-year-old Jay to give him the courage to do as you've done, to go into the impossible?
It's really easy for young people, and certainly that was true for me, to think that everyone else around you, especially the older people who have distinguished careers, know everything, and that they can tell you, you're onto something or not onto something. I tell that 20-year-old, a 30-year-old that's doing science, no one really has all the answers. It's not, and if they're telling you no, it's not because they know no. They just that's the knee-jerk reaction. Almost everything is wrong. You need to have some confidence in yourself. You might be right. And all of the old guys around you with gray hair might be wrong. That's certainly possible. It's almost, that's how science advances, Brian, is when gray hairs like me get proven wrong.
Right.
And I think that's a really good thing.
Yeah. Well, Dr. Jay Bhattacharya, professor at Stanford School of Medicine, MD, PhD, health policy expert, so much more. This has been such a treat for me, Jay. I'm going to have links to your Twitter profile where you can follow Jay at Dr. J, letter J, Bhattacharya, and follow him and tune in. And I do hope you'll share. I mean, this audience is, gonna expand your profile, just so exponentially. This appearance, Jay, you won't be able to handle it, but you won't lose any weight. Maybe you'll gain some weight from this exposure. But I do hope you'll share it in the form of a memoir, because it's such a remarkable story of courage under extreme fire. I mean, basically the worst situation an academic could find him or herself in that you've weathered, hopefully for good. And I wish you blessings and peace. I think that's nothing good can come without the blessings of health and peace. So, Jay, thank you so much for being on the podcast.
Thank you, Brian. I'm so honored to know you as a friend. Thank you for the podcast.
It's a blessing for me, my friend. Take care.
Take care. Bye.